of love with you. I never loved someone way that I'm loving you. Oh, baby, I'm falling. I'm falling. Falling. So now I keep on falling in and out of love with you. I never loved someone way that I love you. You wanted it munyamanza wingwe, yeah. Thank you. Thank you. So I'm gonna be performing the next Saturday as well, on the 14th at 2 p.m. Thank you so much.
Let's give another round of applause to Ariel Ways. Thanks for a wonderful performance. So as you know, we're here to introduce Hamwe Festival, which is happening for the second time. Annual event that happens every year, started last year. So we're going to have a short video that is introducing the event. So for those people who are on the technical team can help us project the video. So mbabwiye turashimira cyane umuhanzi umaze kuturirimbira. Tugiye kugera mu mwanya wo kureba video ntoya iza kubabwira muri make Hamwe Festival n'icyo ari cyo. Ni festival igiye kuba bwa kabiri yatangiye umwaka ushize. So ubwo abari ku buhanga bw'ibyuma badufasha kuyishyira kuri screen tukayireba. Murakoze.
Our work started as we were exploring how creative industries could collaborate with health sectors, and we were also exploring the role of culture in health.
When we talk about mental health, these are everyday experiences. The work that we are doing on mental health, everyone should be involved.
Naganiriye n'abahanzi twari kumwe, ariko kumva ko hari abahanzi bashobora kwinjira muri sekta yacu kandi mu buryo buteguye neza, twumvishe bidushimishije.
Yaba ari ukwandika, yaba ari gushushanya, buriya ibibazo byo mu mutwe nabyo ubuhanzi bushobora kongera kugira ngo umuntu asubire mu buzima busanzwe.
My hope is the festival will foster understanding, collaboration between the different healthcare sectors, the different artists.
Thanks for the video. So I'm now inviting the panelists to start heading to the podium. We're going to introduce, today we're going to have a few speakers. The first speaker is going to be the Vice Chancellor of the University of Global Health Equity, Professor Agnes Vinaga, who's going to be joining us live on Zoom. So we're going to hear from her, and then after that we're going to hear from Grace Gatela, who's the representative of the Wellcome Trust. And then we have Mrs. Njonge, who's leading Hamwe Festival. And then the Deputy Vice Chancellor, financial affairs at UGH, Mr. Rogers Muradije. So let's hear from the VC.
Good morning, everybody. Do you hear me? Do you hear me?
Yes, we can hear you.
Good. So hello, everyone, and thank you for your interest in UJG Hamwe Festival. The idea of Hamwe Festival came naturally in our quest to multiply the ways for better health for all, better access to health for all. We know the power of heart in creating awareness about various public health challenges and in engaging the public creative way for protecting and promoting their own health. Hamwe Festival generates new insight and brings public awareness into global health challenges and corresponding solutions. Using the unique and global health professionals, make a significantly positive contribution to patients facing mental disorders or mental illness due to the impact of other diseases such as chronic disease or terminal ill conditions. To mental health patients, it has an impact and heart help managing it. And this across the world. So Hamwe Festival that was created to bring the health sector together with the creative industries, to explore new ideas around healthcare through new perspective is the ideal platform for such exploration. And already Hamwe Festival is recognized for leveraging the arts to promote better health outcome. Hamwe also created to celebrate the contribution of artists and art and the creative industries to health and well-being of the people around the world. Last year, artists and global health all over the world shared their experience and insight with festival attendees over 5 days period. And this year, 2020 Hamwe Festival has prepared the country, the university, and the world for the same level of global dialogue and experience sharing that will result in new health service to patients. But due to COVID-19, we will do that virtually with the same impact, I guarantee it. This year, Hamwe Festival will be partnering with Wellcome Trust, an independent global charitable foundation from UK, with a mission totally aligned with Hamwe Festival. That is to improve health and by helping great ideas to thrive, and by supporting big health challenges and campaigning for better science through, among other, research. All that we do around the role of heart and health. This partnership with Wellcome Trust is made in part with Mindscapes, the Wellcome Trust International Cultural Program about mental health. Hamwe Festival is an example of UGAG's commitment to innovation and to radically transform health education and health service delivery, as well as the university acknowledgement of the growing evidence based for the role of art in improving health and well-being. At UGAG, we believe that through Hamwe Festival, the implementation of all more health programs, including artists, can be a catalyst for action to solve health challenges, and we are looking forward for innovation and new collaboration. Since the beginning of this year, 2020, for example, we have noticed many examples of positive outcome and the mental health improvement due to the inclusion of art in the life of people suffering from disorder, mental illness, linked to the lockdown and the isolation caused by the current pandemic COVID-19. This has happened in many settings where people had problems to cope with the needed societal behavior changes to stop the spread of the pandemic. We believe that the problems existing in the field of global health are complex and multifaceted, and therefore require cross-sector collaboration to generate new perspectives to solve these challenges for the benefit of all. For example, to fight stigma. Collaboration of stakeholders from different institutions, fields, and actors from various disciplines are crucial to the success of solving world problems. This is why UJG emphasizes and teaches multidisciplinary approaches to solve those complex global health issues and create public engagement initiatives such as Hamwe Festival to offer platform of discussion for all age, because with the theme of this year, mental health, this issue concerns all ages, from children, the youth, and older people. And it is imperative for UJG to focus on the disproportionately affected people made vulnerable by mental health illness. UJG is a hub of knowledge and ready to be on the front line of mental health awareness. We have to utilize our research capacity and our network to identify the problems and generate new knowledge and provide solutions to global health problems. We need to explore issues of mental health further, raise awareness among students, among our staff and faculty, and the larger public. And this is why we are very happy to partner with you, the media community. At UGAG, we are also cognizant of the community and the country that we operate in. We take into account our history, our culture, as well as the need of Rwandans that are linked to our recent history and trauma due to the 1994 genocide against the Tutsi. We already see the existence of transgenerational trauma among our kids. With this history and the current implication coupled with the fact that it is part of our mission at UJG to contribute to the wellness of our nation, we need to raise awareness about mental health and encourage the use of different approaches to addressing these issues and complement effort done by national and governmental organizations. This brings me to the theme of this year, social justice and mental health. Two pressing issues, especially during this time of COVID-19, two issues that are really interlinked. More than ever, the vulnerability caused by mental health disorder needs support, and it is social justice to help providing it. During COVID-19 pandemic, we have seen an increase in mental health issues across the world. However, while the need of mental health service is increasing due to COVID-19, COVID-19 has disrupted critical mental health services in many countries. The theme of this year, mental health and social justice, has a broad agenda. UJG through Hamwe has started to confront the mental consequences of colonization. Also, it is a platform to discuss the decolonization of public health and global health and medicine at all levels through shift in knowledge and education, promoting indignity, the recognition of what each can provide, and advance the global agenda of equity in all continents. What Africa is achieving is too many times ignored in the global health history. UJG is dedicated to teaching equitable health services delivery in a holistic manner, including mental health and ensuring that no one is left out, which is one way of combat social inequities. We are also committed to work with all sectors, with you, the media, and with the industries. that are working with art and the artist. Thank you very much. Back to you.
Thank you. Let's another round of applause to thank the VC for those wonderful remarks. Arakoze cyane umuyobozi wa kaminuza ya Global Health Equity. Nagira ngo nibutse abantu batambaye agapfukamunwa ko mwagerageza mukakambara mu gihe tugerageza kubahiriza amabwiriza. Just reminding people who are not wearing their masks to please wear their masks as we continue to observe the rules of the pandemics. So next we are going to hear, I wanted to introduce another panelist that joined us.
Speak after Dr. Agnes Vinaga because she is one of those incredibly inspiring people who have dedicated decades of their time and effort for better health outcomes for underrepresented communities worldwide, but particularly in our beautiful country, Rwanda. The Wellcome Trust is an independent global foundation, charity foundation, that is interested in funding research into science, questions about science. And our new strategy puts a focus on infectious diseases, but also on mental health. We're very interested in understanding some of what makes mental health and how we can create a better community for everyone in the future. And in that way, we are very delighted to be partnering with UJC for their second Hamwe Festival, which focuses on themes of social justice and mental health. The partnership between Wellcome and UGHE through Hamwe started last year, where one of the people, the team at Wellcome met in Jonge during their very successful Women in Global Health showing, and then the Hamwe Festival that followed after. And I know I speak for all of them when I say that they're excited by the array of speakers, artists, and presenters, and are extremely looking forward to exploring some more of these themes and the work next week. Like Hamwe, the Wellcome Trust believes that global health equity can only be achieved when bridges are built cross-sectorally. In fact, the Hamwe Wellcome Partnership was developed through a similar lens and through the Mindscapes program, which encourages the Hamwe way of looking at health equity, a shared understanding on a transformation in how we understand, address, and talk about mental health by inspiring relevant and meaningful conversations that seek out a diversity of experience and place. By telling different stories and building shared narratives, we believe a cultural approach can contribute to a better and broader understanding of mental health. The Wellcome Trust supports science to solve the urgent health challenges facing everyone. We support discovery research into life, health, and well-being, and we're taking on 3 worldwide health challenges, which are mental health, global heating, and infectious diseases. In fact, we so believe in this mission that we have just launched a strategy that reflects these commitments, which we believe are growing more urgent by the day. This strategy and further details can be found on the Wellcome website. In conclusion, we would like to thank UGHE, the Hamwe Festival, as well as the government of Rwanda for the opportunity to take part in such a groundbreaking event, and as we work towards a vision where in a world in which no one is held back by mental health problems. We will be participating in a couple of programs next week, some of which include COVID Living, Collective Resilience, a workshop which I personally will be a part of, and there will be a Wellcome Photography Prize event next week. So please continue to stay tuned, continue to cover this, because This festival is important, not only for Rwanda, but for the world. Thank you very much.
Thanks, Mrs. Grace Gatera, who's a welcome representative. So next we are going to hear from Injonge Karangwa, who's the chief organizer of Hamwe Festival, and she's going to be talking about the Hamwe schedule. Tugiye kumva ukurikiyeho ni Injonge Karangwa uhagarariye Hamwe Festival, agiye kutubwira ibikorwa bizaba bigize iki cyumweru tugiye gutangira. Murakoze.
Thank you very much. So I want to start by thanking Welcome Trust, represented by Grace here. I think it's a great honor for us to partner with an organization that has been thinking about those questions in different parts of the world, and to have our efforts amplifying by this partnership. So thank you very much. So my role is to be the chief organizer of the Hamwe Festival. So right now I will talk to you about what we have prepared and how we plan to organize this conversation about mental health and social justice. As it was mentioned by our Vice Chancellor, the theme of this year is social justice and mental health. We believe that building bridges with different sectors is very important. Mental health is the problem of the whole society, and it's a global problem. There's currently a global mental health crisis. So all sectors and all age group should be invited to discuss it, understand it, fight stigma. So that's what we're trying to organize. The first day of the festival, we'll actually discuss this with our partners from the government of Rwanda, and also our partners from PH. You know that UGHE is a PH, it's a project that was initiated by Partners in Health. So we'll have the Honorable Minister of Culture, Paul Farmer, and also a great performance by Bill. We try to have a platform that is joined by people from different perspectives, different expertise, and also different geographies. So that we can learn from each other and advance this very important conversation on mental health. The second day of the festival, we'll discuss in more detail, more technically, about how to integrate the arts in mental health research and also in mental health intervention. We look at the benefits of this type of interventions and different outcomes, the specific outcomes that can come from the collaboration between arts and health. On the third day of the festival, we look at specificities of music, photography. Grace mentioned the Welcome Photography Prize. We look at the perspective of different photographers from all over the world on how they're helping to shed light on issues related to mental health and social justice, and how it's changing perspective of the public and also changing perspective of the subject of this photography. We'll also, on the first day, look at the importance of self-expression. Expressing oneself is very important to be part of a society. We look about the importance of hearing from patients, hearing from the youth, hearing from different marginalized groups, and how arts can help doing that. And on the 5th day, we'll touch at a very, very important topic when we talk about mental health. It's about decolonization, how all perspective can be integrated in the mental health conversation, and how also an history of social injustice have affected the mental health of people today. From there, we will also try to gather what we have learned during those 5 days. So we invite you in following that. I think you have received a program. We're very happy to discuss it more in different sessions after that. So yes, that's what I wanted to share with you. Thank you very much. The festival will be held virtually. As mentioned, we are in the times of a global pandemic and had to be very cautious to protect our health and also the health of others. So we'll have it held on the YouTube channel of the University of Global Health Equity, on the Twitter channel of the University of Global Health Equity, and on the Facebook channel of the University of Global Health Equity. And you can register on our website. Thank you very much.
Thank you, Njonge, for the run-through of what's happening next week. And I hope you guys are excited with the different events that she had just mentioned. So the next speaker is going to be Mr. Rogers Muragije, who's the Deputy Vice Chancellor of UGHE in charge of Administrative and Financial Affairs. And he's going to be telling us about the overview of the Hamwe Festival, but in Kinyarwanda. So nagira ngo nakire umuyobozi wungirije wa kaminuza ya Global Equity, Bwana Rogers Muragije, ugiye kutugezaho muri make iyi Hamwe Festival mu rurimi rw'ikinyarwanda. Murakoze.
Murakoze Enoch, ndashaka kubanza gushimira abavuze mbere yanjye nk'uko bababwiye. Nitwa Rogers Muragije, nkaba ndi umuyobozi wungirije ushinzwe imari n'ubuyobozi kuri University of Global Health Equity. Maybe kugira ngo mbisobanure neza, University of Global Health Equity ni kaminuza mpuzamahanga y'ubuzima rusange kuri bose. Nashaka mbisobanure neza mu Kinyarwanda, then ngarutse kuri icyo duhurije hano uyu munsi ariyo Hamwe Festival. Hamwe Festival ihuza urwego rw'ubuzima n'abahanzi. Kandi iyo tuvuze abahanzi ni abantu batandukanye. Harimo abantu bo muri film, dufitemo abantu bo muri abo kubyina, dufitemo abantu b'abanditsi bo muri literature, dufitemo abantu batandukanye n'inzego zitandukanye. So Hamwe Festival ihuza urwego rw'abaganga, ikaza igahuza n'inzego zitandukanye z'abahanzi. Intego nyamukuru ya Hamwe Festival ikaba ari kugira ngo ihuze abo bantu bose, kugira ngo bahange udusha two gushakira ibisubizo bitandukanye mu by'ubuzima. Hamwe Festival yatangiye umwaka ushize 2019. Ihuriza hamwe abantu benshi bagera ku 3,000 bavuye ku bihugu 81, harimo n'inzobere zitandukanye z'abaganga, z'abahanzi. So byose yabahuriza hamwe kugira ngo nibwo nuzanyene Hamwe yatangiye kugira ngo bahurire hamwe bose ibegeranye, then barebe ukuntu bafatanya gushaka ibisubizo bitandukanye byo mu buzima. Icyo nashaka kongeraho ni ukongeraho yuko Hamwe muri uyu mwaka iraza kwibanda cyane, nk'uko narimaze kubivuga, guhuza izo nzego ebyiri, ariko cyane bareba ubuzima bwo mu mutwe. Nibwo bari buze kuba
Said in English, we're going to welcome Mr. Bill Ruzima, who's an artist and is going to be talking about his performance and his art and how it links to Hamwe Festival. Bill, welcome.
Murakoze. Nitwa Bill Ruzima. Ndi umuririmbyi nkaba n'umwanditsi w'indirimbo. Umuziki wanjye ukaba wibanda ku buzima busanzwe hamwe n'ibibazo bibera mu muryango mugari. Mu buzima busanzwe by'umwihariko muri ibi bihe turimo, ubuzima bw'abantu benshi buri kunyura mu bibazo bitandukanye, birimo umuhangayiko ukabije kubera ibihe muzi turimo bya COVID-19. Bikaba bikora ku buzima bwo mu mutwe nyine ku bw'izo mpamvu za COVID-19 mwese muzi. Bikaba ari ibihe bitoroshye rero ku buzima bwo mu mutwe twese, yaba abahanzi n'abantu basanzwe basanzwe muri rusange mu muryango mugari. Ibyo bibazo bikaba bitoroshye rero umuziki ukaba ari umuti ubasha guhangara ibyo bibazo mu nzira yo guhumuriza no gufasha abantu bakomerewe muri ibi bihe. Ibyo rero bintera kwishimira ko ndi umunyamuziki kandi nkaba ndi umwe mu batanga uwo muti uhumuriza abantu muri ibi bihe. Nitabiriye iserukiramuco nje kureba rya Hamwe, nitabiriye Hamwe Festival nje kureba no kumva bwa mbere umusangare hamwe na Nirere Chanel. Bwa mbere nari mpari, none ubu bikaba byanshimishije cyane kuba ndi umwe nanjye mu bagiriwe icyizere cyo gufatanya kuba nahumuriza nanjye ibihangano byanjye byabasha kugaragara bigahumuriza abantu muri ibi bihe no gutanga ubutumwa bufasha abantu, binunganira abantu mu byerekeye n'ubuzima bwo mu mutwe, cyane cyane ko imiziki yanjye ifite aho ihuriye n'ibyo bintu aricyo mikorera cyane. Aka kanya rero ndashima cyane University of Global Health Equity kuba barangiriye icyizere ibihangano byanjye bikabasha kuba byabona umwanya wo gutambuka no kugaragarira benshi, bikanabahumuriza nk'uko aricyo mbikorera. Nzakora igitaramo cy'iminota 30 kuri 11 z'ukwa 11, kikazaba kizanyura kuri YouTube, Twitter na Facebook bya University of Global Health Equity kuri izo tariki 11. Nkaba nizera ko bizanyura abantu bose bazabireba. Nditeguye kuba nakora igishoboka byose ngatanga umusanzu mwiza muri ibyo byo guhumura muri ibihe, kugira ngo mpumurize abantu, nkomeze kubaremamo icyizere. Ndatekereza bizaba byiza. Murakoze cyane.
Arakoze cyane umuhanzi Bill Ruzima. Thank you so much, Bill, for sharing your journey, performing and inspiring hope in the Rwandan society. So we are now in the Q&A session, and I'm going to just give you some instructions that we're going to go by. So we want people to come. If you have a question, we want you guys to start lining up. Make sure that you are socially distanced as you line up, and then you will have to come up to this mic in the front. You introduce yourself, your name, and the media outlets that you're coming from, and then address your question to one of the panelists. Ngira ngo navuga ko tugeze mu kanya k'ibibazo cyane uko kuganira n'itangazamakuru. So uko biri bugende rero turakomeza kubahiriza amabwiriza ya COVID-19. Ubwo abafite ibibazo baregera imbere, mutonde umurongo hano imbere ariko musigamo wa mwanya. Noneho ufite ikibazo arageza hano kuri iyi mikoro, kugira ngo ntabwo dushaka ko abantu bagenda bahindura za kamera zabo, turagira ngo buri wese avugire hano imbere. Uravuga izina ryawe, uvuge n'igitangazamakuru uturutsemo, noneho ikibazo cyawe kibazo umwe muri aba ba panelists dufite hano imbere. So ubwo abafite ibibazo mwatangira kuza. Those who have questions, feel free to start coming to the front.
Today na Keti Radio. Zijyanye no guhumuriza muri ibi bihe, jewe ikintu naniteze numvaga nateguyeho gukoraho amakuru ni ikijyanye no kwigisha abantu ahubwo ku benda uburyo bashobora kuba bakwifata ku bijyanye n'ibibazo bitera uburwayi bwo mu mutwe cyangwa ubuzima butari bwiza bwo mu mutwe. Nicyo nari niteze, rero ndimo kwibaza niba ari indirimbo zihumuriza gusa, niba nta kindi kintu afite azongeraho kijyanye no kwigisha abantu ku bijyanye n'ubuzima n'ibibazo by'ubuzima bwo mu mutwe, kwirinda izo ndwara cyangwa se uburyo bafata abo bantu. Nicyo numvaga nanjye numva namubaza niba hari icyo yabiteguyeho. Hanyuma nyakubahwa umuyobozi wa kaminuza, umuyobozi wungirije wa kaminuza yigisha ubuzima mpuzamahanga y'ubuzima bwo rusange, nari ngiye kubaza hari impamvu yatumye mutegura iri serukiramuco rijyanye no kuvanga n'ibiganiro n'abantu. Hari impamvu, wenda hari inyigo cyangwa se hari background, hari amateka y'ibintu byagiye bigenda ku buryo mwategura iri serukiramuco. Murashaka gutanga ubutumwa muri rusange, murashaka ko abanyarwanda bagira iki, basigarana iki nyuma y'iri serukiramuco. Murakoze.
ngira ngo turafata ibibazo nka bitatu noneho tureka abasubiza. We're going to take 3 questions and then afterwards we're going to let the panelists answer.
Good morning. My name is Daniel Sabiti. I'm a journalist from Kigali Today, Keti Press, specifically. I am very sorry I was moving up and down, but I was following up the session. I didn't get most of the names clearly, but at least I know what I'm going to ask each one of you. My first question will go to Dr. Agnes Vinaga. Thanks for the enlightening opening remarks you gave us. But I would like to know, you said something about that art has been very helpful during this time of COVID-19. So I would like to know if there is any analysis, assessment, any kind of research that you have done to actually show the direct impact that art has played in comforting or actually helping people to cope with COVID-19. Because I know you're a researcher and you do numbers, so maybe you can also give us a little bit of how the numbers there. The second question goes to the organizer. I didn't get your name, but I'm sorry for that. What are some of the expectations? You know, it's a festival, yes, but what are some of the expectations from the organizers, from the participants, even us, journalists, you know? What are we going to learn? What are we going to be asked to do? What is this going to leave us with? How is it so different from last year? If you can give me those questions, I'll be so delighted. The third question, and almost the last one, which has part B in it, goes to the musicians or the artists. How many artists are going to be in the festival? Who are they? What is their background? What is their categorization? Are they folk, cultural? Are they pop? Are they modern? Are they karaoke? What kind of things are we going? What kind of music? What kind of art? Is it drawing? Is it? I don't know. You know what I mean. So, and part B of that question goes to that young man who's very eloquent. By the way, thank you for your speech. It was very good in Kinyarwanda and very eloquent. Mwebwe nk'abahanzi wowe ufite amahirwe hariya ni Bill, at least I got that name, Bill. We Bill nk'umuhanzi n'ubwa mbere nkubonye kandi Imana ishimwe. Urumva ko nawe uriyamamaje nanjye ndakumenye. Wowe nk'umuhanzi kuba uri mu iki gitaramo bivuze iki? Ese birakuzamura bikuvane, simbuze kuri underground, ariko bikuvane kuyenera, bigushyire kuyenera? Ni exposure kuri wowe cyangwa ni gushaka amaramuko? Ese ni iki kuri wowe ku giti cyawe? Waba ukoze cyane, murakoze. Thank you very much.
I think for now, let's answer those questions that we have had. I've had the request that we should start with Professor Agnes. Professor Agnes, can you hear us?
Yes, do you hear me yourself?
Yes, yes, go ahead.
Yes. So I want to say that we have done studies in Rwanda, but the results are in analysis. We are analyzing it now, and we will share with you, because the objective of such research is really to disseminate it and to show the health sector, the local government, and others where we stand. But there are other research that has been done in other countries, and I'm ready to send you the report of that. There are research done in children, almost 2,500 children in Kenya, and there are research done in other places. So yes, there is evidence globally, and COVID is not only something that we face in Rwanda, it is faced by all over the world. And all over the world, there are research done, and I will share that with you after. Stay in contact with Injonge, she will give that to you. The research done in Rwanda, we done it with community health workers. We done it at community level, and more to come and more to share. Thank you.
mu by'ubuzima Hamwe Festival yatangiye umwaka ushize 2019.
Results from preliminary research on how young people survived during COVID, and focusing mainly on art and music and you know, like drawing and stuff. And then collective resilience, which is actually different people sharing what gave them strength during the COVID, and some of the results are from young Rwandans too. That we collected. So please stay tuned for that. There's actual research there. Thank you so much.
Thanks, Grace. So we're going to go in order. We're going to start with Njonge, and then Rogers, and then Bill. If you could address your questions, please. Thanks.
There are many. We hope that first we will interest the audience about this very important topic that it should be a matter for all of us. WHO shows that globally, 1 in 3 persons would have a mental health problem of different sorts during their life. So it could be any of us, it could be people around us. So learning about it is important. Learning about what is a mental health, what is mental illness, what is mental health opposite to the illness and the disorder, and how do you maintain yourself in mental health in difficult time. Coping is also very important, and we'll talk about that in that session, for example, to relay the questions about arts and in times of COVID. So that's the main expectation, to disseminate research, disseminate ideas, disseminate the work that some people, the good work that some people are doing, and also discuss this important topic, mental health. And when you talk about mental health, it's very difficult not to talk about social justice. So we want also this to be integrated in the conversation. Then who is going to speak at Hamwe Festival? So we have more than 60 speakers and artists. So I'm not going to be able to name all of them, but please go and check on our website. There will be a lot of information. I'll give you some information though. There will be visual artists. One of our main projects is a project called Stigma, Power and Hopes. And we had a residency with 4 Rwandan artists, Timothy Wandulu, Krista Wase, Alice Kaibanda, and Moses Iribagiza. We have discussed with them the social justice and the social determinants behind mental health issues, and also the problem of stigma. We believe that one of the best ways to address stigma is information. You don't fear what you understand, you don't fear what you know about, and you know how to react in front of it. So we want to disseminate through that project a lot of information about mental health, about the experience of the people that have faced mental health issues across their life or are still facing them now. We have also artists like you heard the beautiful performance of Ariel. She will also perform. Bill will perform. We have different other Rwandan artists, dancers. Frank Mugisha, for example, will perform. But we have also internationals that will perform. We have Muzue from Japan, Tsokumaela from South Africa, Etinoza Yvonne from Nigeria. So we have a very global lineup, very different art expression, from photography to music to dance, painting, collage, because we believe that every expression channel could have something to say about the experience of a human, subjective experience or collective experience. And that's what is going to be discussed in the 5 days of the festival, from the 11th to the 15th of November. I hope I addressed the question.
Thanks, Njonge. Next we can hear from Rogers.
Ikibazo ngiye gusubiza bambajije ngo niki abanyarwanda basigarana nyuma ya Hamwe Festival izaba next week, cyangwa se mu cyongereza nazita expectation, icyo dutekereza kizava muri Hamwe, or what we can call success muri next week. Hamwe ya next week izaba next week. So icyo nashaka kuvuga nagisubiza mu buryo bubiri. Icya mbere, nk'uko abandi babivuze, bagenzi banjye bose babwiye yuko izahuriza hamwe abahanzi n'abaganga batandukanye, so bakaba bazasharinga information research wo kuvura cyangwa se wo gutuma umuntu atagira ibibazo,
kwigisha ku byo ubuzima bwo mu mutwe, ariko guhumuriza abo babifite, kuko hateguye iki gikorwa bagendeye kuri icyo kibazo cy'abantu, ku kibazo cy'abantu babona bafite ibibazo bigiye bitandukanye byo mu mutwe, kandi usanga koko bihari. Ugendeye no kuri ibi bihe turimo, ugendeye ku muryango mugari, imikurire mu buryo twakuze twese, ugendeye ku mateka yabaye ku gihugu, buri kimwe cyose bigaragaza ko ibyo bibazo bihari. Rero umuziki ukaba ari umuti, bashaka kwerekana nk'umuti ugomba kuba wafasha abantu muri ubwo buzima bwo mu mutwe, ukabafasha kubahumuriza. Urumva, kubahumuriza habamo no kwigisha ubutumwa bwigisha abantu kubana, gufashanya, ibintu nk'ibyo, kugira ngo hakomeze kureba nyine kwiga no umuti, nyine kubona umuti wo kugira ngo ibyo bibazo bitakomeza kuba bigari cyane. Daniel yabajije ngo bivuze iki kuba muri iki gitaramo, ngo ni ugushaka naba ari uburyo bwo kuba kugaragara cyangwa n'ibindi, ariko uyu ni umwanya mwiza. Ndashimira University of Global Health Equity ko bahaye umwanya abahanzi batoya bakizamuka, bakabagirira icyizere, bakatubonamo ubushobozi bw'uko natwe dushobora kuba hari ubutumwa dushobora gutanga, bugafasha umuryango mugari, bugafasha abatuye isi, bose nabyo ni iby'agaciro gakomeye cyane. Rero uyu ni umwanya wo kugira ngo natwe urumva urubyiruko ruzamuka, kandi ibyo bibazo byo mu mutwe by'ubuzima bwo mu mutwe biri akenshi usanga nanone biri mu rubyiruko rurimo kubyiruka. Harimo hagakunze kugaragaramo, urebye nk'umubare w'abantu buri gihe nko mu Rwanda twese turabizi, dukunze iyo bavuze ngo umuntu yiyahuye akenshi usanga ari urungano rwacu, ari urubyiruko rutoya tujya kungana, ugasanga nibo benshi. Wagiye kuri etaje akamanuka, uribye usanga ari urubyiruko turi mu kigero kimwe. Ubwo urumva rero ni iby'agaciro kuba baraduhaye urubuga rwo kugira ngo tubonere umwanya wo kwigisha no guhumuriza no kumvisha abantu ko ubuzima nyine bugomba gukomeza, bagomba kubaho. Rero nicyo gitumye ndaha ndi umuhanzi uzaseruka muri Hamwe Festival. Murakoze.
Murakoze Bill, barakoze cyane. Ngira ngo twafata, sinzi niba hari abandi bagifite ibibazo, twafata abantu babiri kuko ndagira ngo mbibutse ko nyuma y'ibibazo bari bugire na interviews n'abantu bamwe muri aba ba panelists. So n'abadafite ibibazo nta kibazo, murakomeza nabibaze nyuma y'iki, ariko twafata abandi babiri. Yeah, 2 more people to ask questions and then we can wrap up.
Murakoze. Nitwa Dosi Jeanne Giselle, abankorera Flash TV. Ikibazo nagira ngo mbaze, mwagaragaje ko muri ibi bihe bya COVID-19 hagaragaye ibibazo bitandukanye birimo n'imyumvire idasanzwe. Mu by'ukuri iyo myumvire idasanzwe ni iyihe? Mbajije umuyobozi wa kaminuza.
Good morning. My name is Andrew Israel Kaziwe. I represent the East African and Rwanda Today newspapers. My question, the first question would go to Dr. Agnes. When it comes to events and different institutions, we have rarely seen institutions, even education institutions, making an entry using the arts. And with the University of Global Health and Equity introducing the Hamwe Festival, it gives a new feel. I would like you to give an insight, share with us an insight on what inspired and what transpires this inspiration compared to the environment we see. Most of the companies or institutions will occasionally need the arts, but this is like a really strong bond. Share with us that. Another question would go to you, Njonge. When it comes to the mental health, sharing this, we see you using the arts, of course, indeed, but could we say that the arts could be a core remedy or therapy in healing or solving the mental health issue? Thank you.
Okay, murakoze. Mbanje kubashimira kuri iyo ntambwe mwateye mu guhuza ubuzima n'ubuhanzi muri rusange, nubwo mwibanze cyane cyane kuri sinema. Nje nitwa Elisha Clever Rukundo, mfite initiative yitwa Deus Worthy, naje mpagarariye ikinyamakuru Goodrich TV. Ikibazo cyane ndakibaza Njog, uranyemerera mbaze mu Kinyarwanda niba cyumva neza. Okay. Ngarutse ku kibazo cyanjye, ndabona cyane cyane new generation cyane cyane abari mu mashuri. Nubwo nta bushakashatsi bwari bwakorwa, biragaragara ko bagizweho n'ingaruka za covid cyane cyane abangavu. Ni uwuhe murongo wihariye mwaba mwarashyizeho ngo harebwe uko aba batewe inda bitabwaho ariko nanone bagahabwa ubutabera nk'imwe mu ngamba zo guhangana n'ibibazo bazahura nabyo cyane cyane mu buzima, dore ko bifite aho bihurira n'imitekerereze cyane ubuzima bwo mu mutwe. Ikibazo cya kabiri cyane ndakibaza Dr. He's not around? Yes. Ni ikijyanye na cultural heritage. Iyi cultural heritage niyemeje kuvugira nayo igira aho ihuriye n'ubuzima ndetse n'ubuhanzi, habe ku miti gakondo, habe ku buryo bajya bakoresha bavura. Mbese nka University of Global Health Equity muri rusange ndetse na Hamwe Festival by'umwihariko, hari uburyo muteganya yaba mu gukora ubushakashatsi ndetse na implementation y'izi ngamba kugira habe habungwabungwa uyu murage nyafurika, dore ko uhatse byinshi cyane cyane ku buzima, yaba mu kuvura ibibazo cyane cyane bifite aho bihuriye no mu mutwe. Murakoze cyane.
Good morning, everyone. Since I'm alone, can I take it off? I'll ask my question based on, I have two questions. My first question is in reference to a report produced by, or presented in Parliament a couple of days ago, that talked about very disturbing numbers of incidences seen in the community, that there were extreme numbers of not only strange behavior but very dangerous behavior of extreme violence across the country, that in several districts people were taking the law into their hands to the extent that they were not only harming people but even killing a mother, killing a child, or a husband killing a wife. And these numbers were causing a lot of uncomfortable conversation in Parliament. And they were saying these are signs of mental issues. And members of Parliament suggested that government, researchers and academic institutions need to dig deep into this subject, because it is not only causing a healthy problem but also a security problem. As a university that is very much into mental health and health in general, I would like to hear whether you are aware of this and what you've discovered, or your take on this subject. My second question is, in that first question, I think Joy can also tell us what art can do to address that problem. My second question is about, again, on a research, a survey conducted between 2017 and 2018. It was produced last year. And it is said that 35% of those who were surveyed were genocide survivors who experienced major depression episodes, to the extent that it was causing an alarming situation in the country. Good that Dr. Vinaga is here, who has been in health in Rwanda for a long period of time. 26 years now, we are experiencing these numbers. what happened, what went wrong, or what wasn't done that we are seeing these staggering numbers today? Yet, you earlier said that art was or has been identified as one of the remedies to mental health. How come almost 3 decades today is when we are discovering that, hey, we have a problem, let's use art? What went wrong? What couldn't have been done right? And maybe you could also explain, this is for the Hamwe Festival. Could you outline for us the tools or the form of art that is specifically or recommended to extreme levels of mental health or illness? Thank you. My name is Magnus from Tarifa.
Thanks for all those questions. I think we're again going to start with Professor Agnes. I had just been told that Professor Agnes wanted to address or had an addition for the last round of questions. So, Professor Agnes, if you can hear us, please, the floor is yours. You can start with the questions from the last round or the additions and then go on to the questions from this round. Thanks.
Thank you, but do you hear me?
Yes, yes.
Yes. So I first want to say that for the previous round, what we expect by doing a festival this year, I just want to remind that at UGG we believe and we know, and it's proven, that the problem existing in the field of global health concerning health are complex and multifaceted, and therefore require multiple approach, cross-sectorial collaboration to generate new way to solve them. So the multidisciplinary approach in the case of Hamwe Festival, what is a major tool for the university, will support many of the many health issues. This year, we focus on mental health. Last year, we focus on women's health and gender-based violence, etc. Next year, it will be another subject to advance awareness, but to advance science, to advance collaboration between what art and artists can bring to the solution in a multidisciplinary way. So it's clear that Hamwe Festival, it's an annual event, an annual platform for the creative industry to come with global health professionals for multidisciplinary approach to solve the complex problem to contribute to solve the complex health problem of global health. But there are many, and next year it will be another one. For the issue of violence, I'm not aware of, but if it's a mental health issue, we know that art help in that as well. And there is even traditional proverb in other language that's saying that les arts adoucissent les mœurs. And for the question on what happened to the children who were this year or even last year, because it started not this year, were suspected to have or diagnosed with transgenerational trauma. Transgenerational trauma is a new discipline in mental health, and it's not in Rwanda only. And it's not that the country has not done what it takes. Just look at Rwanda as a country totally disturbed, where trust was gone, where people had killed, and has recovered like we have recovered 26 years ago. There are very few countries who have achieved such a turnaround of the mental health of the country. But like in many other countries, and it's a fact now. The children of those who died at Auschwitz during the Holocaust didn't face the problem but got transgenerational trauma because of what exists in families, in societies, and what is discussed. So I want to say that when it has been discovered, the Ministry of Health asked and the First Lady advocate for action, research to be taken, and it was done. And this is why now the Ministry of Health is going at school to test the children at risk of transgenerational trauma to help them with clinical psychologists. So it's not that nothing has been done. Things has been done when discovered, and things are ongoing. Only country who face that, there are many countries, almost all countries who have faced huge social stress. So for the question of which art to recommend, there is no specific art we recommend. We just know some, like dance help a lot with Alzheimer and etc. And it's a field that is in research. So knowledge is coming slowly by slowly and implement as it comes. There was other question about the school children that are the most affected by the pandemic. What are the measures UGAG is taken to ensure the ones that are impacted have justice? So UGAG is supporting the government to implement its program for this. And the program that the Minister of Education, in partnership with the Minister of Health, is doing at school to detect the children, to identify the children at risk of being depressed, we are part of that. We are the one who have designed the tool to do the screening of the children. So it's a collaboration. And I want to tell you that there are very few countries who have started this before the problem is identified. We know that there will be a problem, and the government has started, and we are supporting the government. I want also to tell you that we do study now with Africa CDC, and Africa CDC is representing all the Ministry of Health of the continent. UGAG is doing research with them on that subject at community level and in school. I don't know if I think I have answered all the questions, but I'm ready to answer more during this press conference or after. Thank you very much.
Thank you so much, Professor Agnes, for those wonderful answers. So we're going to go to Injonge and
of pathologies and challenges and efforts to stay in a state of mental health. So there's not one simple cure because there are many diseases and many problems. We don't ignore that some of those diseases have a biological explanation. A session of dance doesn't replace certain medicines. What we say is that a collaboration between different expertise and sectors can help think about the problems in a new way, can help communicate information, educate on certain issues, advance stigma, create an inclusive environment for important conversations, and that's what we're trying to do. There was a question about the form of arts. I would say that as finding ways to express oneself, finding ways to be heard, finding ways to relate to issues are things that favor a good mental health state, I would say that all kind of art form can have a contribution. And if you look at the research, there is proof that photography, while improving representativeness of certain marginalized group, helps. There is proof that music therapy give results. There is proof that music improve memory. There is proof that dance help in terms of dementia. So I think that we are just at the beginning of learning what art can do for health. As mentioned, there's a lot of research that is going on at UGHE and all over the world, so we are still learning. And I think that, yes, I addressed the question that were addressed to me, and I'm happy to follow up later if needed.
Yeah, ndumva njyewe ikibazo bambajije ari example cyangwa se yo natanga yerekana ibibazo byatewe na COVID-19 n'ukuntu biri connected na mental health cyangwa se ubuzima bwo mu mutwe. Natanga na example imwe yasobanura byinshi cyangwa se kubiyemo ibisubizo byinshi. Example yo ibura ry'akazi. I think murabizi yuko muri COVID abantu benshi batakaje akazi cyangwa se habayeho ibura.
Answer session. So following this, anybody who has further questions, the artists, make sure that you make your way to the back table. So the table that's at the back, that's where you can request interviews or ask more questions. And then we really encourage you to follow the festival that's going to be taking place next week on the UGHE YouTube channel, the Twitter channel, and all the other channels that will have been given to you in the agenda. And then we encourage you to visit www.ughe.org/Hamwe Festival. And if you have any questions, please contact the email that's listed in the press release. All the panelists, Professor Agnes, thanks for joining us virtually, and all the panelists that have joined us today. So thank you and enjoy. Please keep enjoying yourselves, and also if you have more questions, feel free to go at the back. So mbivuze mu Kinyarwanda twagira ngo dushimire cyane mwe mwabanye namwe abantu bavuye mu bitangazamakuru bitandukanye. Ni iby'agaciro kuba mwaje kwitabira iki kiganiro, kandi turashimira nanone ababanye natwe, umuyobozi wa kaminuza Professor Agnes Vinaga wabanye natwe ku buryo bw'ikoranabuhanga, n'abari bahagarariye kaminuza Hamwe Festival, Welcome Trust ndetse n'abahanzi. Mwakoze cyane kubw'ibisubizo byiza mwatugejejeho. So mbibutsa ko kandi abashaka ibisobanuro byisumbuyeho mwagana urubuga rwa UGHE, www.ughe.org/Hamwe Festival, cyangwa mukandikira email babahaye muri press release. So abafite ibibazo twabashishikariza kujya kuri hari ameza ari hari inyuma, ushaka interview, gukorana interview n'umwe muri aba cyangwa abahanzi n'abandi, wagana iriya meza ukaba wabaza ibibazo byawe. Murakoze cyane, kandi turifuza kubabona icyumweru gitaha muri festival. Murakoze. They just told me one more thing for the people who are looking for their per diem. You can pick it up at the table where you signed up. So abifuza ku hari ishimwe ngira ngo ryagenewe bamwe, ubwo muraribona hariya mwinjira ya table mwanyuzeho, niho mwagana. Murakoze.
I go say I believe you. I go say